New at 5. Potential plans to close primary care clinics at Harborview Medical Center are sending workers and patients into a tailspin. Employees were told last month that Harborview may shut down or move its clinics for women, children, and families. As KIRO 7's Jeff Du Bois reports, now workers are pleading with hospital administrators not to.
Staff got an email last month from administrators saying July 1st would be the last day for care in the primary care facilities at Harborview. The pediatrics clinic alone serves about 2,500 patients, and those are patients who already have appointments scheduled after July 1st.
It would be disastrous for everybody involved.
Camilla Vigil, a Harborview social worker, is worried about her mental health patients and the pregnant women in her care.
We don't know what to tell them. We have no message to tell them where they're going to access care, how we're going to transfer their care.
Today, she and several clinic workers confronted the hospital's board of trustees. Administrators have backpedaled since the announcement, saying they're just considering options.
Seattle's Harborview Medical Center will not be closing its primary care clinics. As KUOW's Sarah Lerner reports, management officially confirmed that message in a memo to staff yesterday.
It's an important development after a lot of fear and hand-wringing. Last December, managers gathered staff at Harborview's primary care clinics right around the winter holidays. They said some clinics could close by this summer, and that the clinics might relocate to other spots in the community. The clinics see more than 2,000 patients every year, many of whom are uninsured or on Medicaid. Staff voiced their objections. A rally was even planned for the Board of Trustees meeting today. Then, management sent a memo to staff yesterday. In it, confirmation that Harborview will not close nor relocate its primary care clinics. Camilla Vigil is a social worker at Harborview's Women's Clinic.
It's great news.
She says people are so passionate about Harborview clinics because they do offer unique care.
We have cultural case managers, we have interpreters from the community, we have nurses and social workers and nutritionists who are very sensitive to some of the issues that we deal with, like human trafficking, refugee conditions, a lot of trauma, a lot of personal trauma.
For now, staff members are celebrating. I'm Sarah Lerner, KUOW News.
Behavioral Health Resources has not been doing well lately. Its cash has dwindled and it's had some unforeseen expenses. In December, the agency had to tap a line of credit to meet payroll. The agency wants to boost revenue by making sure clinicians meet their quota of 5 billable hours a day with clients. But the clinicians say that number can be hard to reach. Ramona Marshall is a case manager and therapist. She says they face discipline for not reaching the quota, even though some things are out of their control, such as whether clients show up for appointments.
In our situation, we have the additional problem of our management having a real shame and blame kind of atmosphere.
Behavioral Health Resources provides mental health and substance abuse treatment for about 10,000 people in Thurston, Mason, and Grays Harbor counties.
Seattle City Council approved a citywide minimum wage of $15 an hour to be phased in over the coming years. NPR's Martin Costi reports.
The passage of the $15 minimum yesterday was a foregone conclusion, and activists had set up a dance party outside City Hall in anticipation. Christopher Morehouse was there. He's a social worker at a homeless shelter. And not only will his clients see a raise, he will too.
Yeah, I make $11.68 an hour.
And so what happens next year to you?
Next year I get a 11% increase in my pay, so which is going to be awesome because I'm going to jump up almost to 13-something an hour.
So Morehouse won't get 15 right away because the minimum will be raised gradually. The speed of this phase-in depends on the size of the company and certain other factors, and some employers won't hit the $15 mark until the year 2021. Still, it's a big step for any city to mandate this kind of wage hike. And Councilmember Sally Clark says Seattle is moving into what she calls uncharted territory.
No city or state has gone this far with minimum wage yet. We are leading the nation with this action, and it's thanks to a tremendous amount of grassroots activism.
Those activists packed the council chamber.
Several nurses at Western State Psychiatric Hospital say they were injured by a patient in an assault Monday night. Today, those nurses are on an informational picket line in front of the hospital, demanding action to make the place safer. KOMO 4's Keith Eldridge is live at the hospital tonight. And Keith, what is their main demand?
Yeah, hi, Molly. Their demand mainly is for more staffing. The number of assaults and the concern for a safer working environment brought many of the 300 nurses to the informational picket line just across the street from the hospital.
Western State Hospital in Lakewood, Washington, under some scrutiny for several years about what nurses call an unsafe environment. There'll be a rally in Spokane today to urge the state and the CEO of Eastern State Hospital to improve safety. Joining us on the KXLY Live line, Shannon Seiler, a registered nurse with ESH. Sharon, good morning.
Good morning. I'm Sharon Seiler.
I'm sorry, that was my mistake.
No, that's okay.
So tell us a little bit about your experience at the hospital and why there's a cause for concern.
Well, I've been working there for 15 years, and I've just seen a marked decline in the staffing as the years have gone by, and because of the budget. So we have tried every avenue to be heard about the staffing at Eastern State Hospital. So it is unsafe. It's unsafe for patients and staff.
So greater staffing, you think, will eliminate some of these problems? Probably not all of them, but some of them?
I believe it would eliminate and decrease the violence and injuries at Eastern State Hospital.
Do you feel like today's rally will help?
Well, I'm hoping. We have tried every avenue to be heard, and I'm hoping that the governor and our CEO hear our commitment to quality patient care. We need to start meeting the needs of our patients. It's so sad that we have to come to this extreme to be heard. All we want to do is care for our patients and get them out in the community and be successful. We want to teach them the coping skills they need.
Well, we're glad that there are people out there like you who want to do this and help the patients at these hospitals. So we appreciate that.
Hundreds of hospital workers walked off the job today at 2 Pierce County hospitals. The group tells KIRO 7's Jeff Du Bois the move was motivated by money and patient care.
At 6:45 this morning, we watched the first workers walk off the job. The disgruntled employees quickly grew in number and volume.
Let's fire it up, let's take no more.
They're upset that 14 months of negotiations with the company that owns St. Joseph Medical Center have produced nothing.
They just aren't willing to budge.
Tracy Pinero, a 30-year employee at St. Joe's, says the company walked away from the bargaining table last week. Now 1,000 co-workers are striking, in part for better health care benefits. But they're also fighting the long hours and extra shifts they have to work to make up for a staff shortage.
That's not safe for the patients. It's not safe for the workers.
Susie Powell, a certified nursing assistant in the oncology department, has seen it firsthand with cancer patients. She'll be helping one person, she says, when another patient has to get up and go to the bathroom.
They're so weak from their treatments that they can fall, and the chemotherapy in a bag can fall with their IV pole on the floor with them.
And suddenly there's a hazmat situation. That hospital spokesman says they hope to be back at the bargaining table after this 24-hour work stoppage is over tomorrow morning. In Tacoma, Jeff Du Bois, KIRO 7 Eyewitness News.